School back in full swing, and we're showing you how to spot possible vision problems in your kids. Dr. Sandy Feldman joins us this morning from Clearview Eye and Laser Medical Center to explain what to look out for. So important for parents. You know, I have a connection with this because when I was 11 or 12, I had the cliche, I had trouble looking at the blackboard from the back of the class, and sure enough, by the age of 12, I had these things on.
Did you have any learning problems?
You know, I didn't. But I saw it early on that I was having, when I couldn't see what they were doing on the board, I said, you know, I got to go get my eyes checked. And my mom said, you got to go get your eyes checked. Yeah. Is that what happens with a lot of parents?
It absolutely does. Children will talk about it. But about 25% of learning problems can actually be due to vision problems.
Because the kids literally, they can't see the blackboard.
Exactly.
At what age should kids undergo their first eye exam?
Well, what most people don't know is that the first eye exam actually happens in newborns right after a child is born. Right. And after that, at about the age of 6 months to a year of age, it's important for kids to undergo their eye exam. Now, proper eye care is really about preventing problems, not waiting until you have a problem.
Right. So how, if I'm a parent and I have my kid there, how can I tell if there's perhaps an issue, something with his or her vision?
Well, if you notice that your child is squinting one eye in the sun, an eye is crossing or turning out, that might alert you that your kid has an eye problem. However,
so squinting in the sun because of what, the brightness and the effect it has? Because well, obviously I have glasses for a long time. The sun, I always tell them here, is like it's so bright in my eyes, almost like I need my sunglasses.
But when you squint, you're probably squinting both eyes. If you notice that only one of the eyes is squinting, that's when the kid may have a problem.
Who is most at risk? There's a new study out as well.
Exactly, the MEPED study. And it showed that there's more astigmatism in children of African American and Hispanic descent. That can lead to a condition called a lazy eye. So it's really important that everyone be aware that that kids need eye exams.
Boy, that's exactly everything. You know, whenever you talk to me, it's like, that's me. I have astigmatism in the eyes, and I was a kid, and everything else. Switching gears for a moment, let's talk about playing sports outside in kids, because it's all about protecting your eyes when you're playing sports, when you're outside. Tell me more about that.
Yeah, most kids don't wear sport goggles, but it's important for parents to remember these statistics. 1/3 of all eye injuries occur in children, and 90% of those are preventable. So why not urge your kids to lead an example and actually wear sport goggles?
Right. Goggles are very important. On the field, how can you tell? You know, we've talked so much about concussions and other things like that, injuries to the head, eyes. How can you tell if your child, if something has happened, if there's a concussion possibly or anything else like that?
Well, reading kind of matters. And there's a new test which is based on something like this, where you ask on the sidelines children to read the numbers back and forth from left to right. There's a few different ones. It's been shown to accurately detect concussions because the speed of reading and the accuracy is reduced if a player has a concussion. I've always said that the eyes are a window to the brain, and here's a perfect example of that.
Are those on sidelines a lot now in schools and everything else? They're using that test a lot?
They're using these things more and more. There's a number of different ones. This one's based on vision. There's also some other ones based on balance.
Some people may not like glasses. If your kid needs glasses, how early can you get them on contact lenses?
Well, you know, I advise people to wait till 8 to 12 years of age for contact lenses. Some kids are more precocious, more fastidious, and they may learn at an earlier age to put them in and take them out. However, it's best to wait till they really are good at cleaning their hands.
Can they prevent further nearsightedness, or is that something that's just going to progress regardless?
Well, some new contact lenses are designed with different shapes in the center or the edge of the lens, and they can actually prevent nearsightedness.
LASIK. Can kids get LASIK surgery, or is the eye still? I've always wondered, how young can you be to get that surgery that so many people are getting these days?
Well, you want to wait until the eyes stop changing. That usually happens around 21 years of age. So it's best to wait till then for LASIK. So that's a good thing to
Right.
encourage your children, maybe as a graduation present from college, to get LASIK.
LASIK surgery, not bad at all. If you would like to reach Dr. Sandy Feldman right here, so you can get the good glass in it, and I can see clearly, thanks to you. Otherwise, I couldn't even read this. See this? ECBDLNPTER. See that? Dr. Sandy Feldman, Clearview Eye and Laser Medical Center, located right there in beautiful Sorrento Valley. All the information on your screen. Fox5sandiego.com. Dr. Sandy, good seeing you as always. Thank you so much.
Thank you.
You can see now. Erica, over to you.
I see you clearly. Thank you.